Texas, New Mexico region that have hopped on with us from some of our nonprofits. And so since we are looks like we're right about on time, so I'll go ahead and do an introduction. And first of all, I want to thank everybody for getting on with us today. This is really a great opportunity for our region for us to connect with and get to know the Community Partnership Fund. I think some of you, depending on how much work you've done directly with us with Covenant Health, you may have heard a little bit about this fund. But the great thing is that this fund is kind of revamping a little bit and expanding. And so they're going to be able to offer some support to our region in addition to some of the grant support and contributions and donations that your organizations may have already received from Covenant. If you haven't, definitely invited all key stakeholders who we know are our community partners who work on different projects and who have similar missions and similar values to Providence Health. And so I wanted to just take a moment to again welcome everyone and kind of introduce you to the Community Partnership Foundation. And they are going to be leading this call, and they really wanted to come in person, but of course with doing this during a pandemic, they're having to do it a little bit different. So we're doing this virtually, like many things have been done lately. But just wanted to welcome everyone and turn it over to the Community Partnership Fund to walk us through this open house so we can all learn more about how we can work together to achieve health for a better world and to really improve the health and wellness of our community.
Great, thank you. Thank you so much, Tavia. Thank
Absolutely.
you for the introduction, and good afternoon. It's still morning here in California, but just want to say good afternoon to all of you, and thank you for making time out of your busy schedules to join us to introduce the fund to you. My name is Gabriela Robles, and I am the Executive Director of the fund, as we call it. So for today, we really want to pretend we're enjoying some cookies and punch and virtually, being able to really have an open house and introduce the fund to you and really learn a bit more about your communities that you serve. And so for today, we're going to be introducing the fund. We're going to share with you a bit about what has been the work of the fund and what are our plans for expansion. And we will have some opportunities to have some discussions along the way. Okay, next, please. And before we begin the open house, we'd like to open up the open house with a reflection. And this is Sister Suzanne Sasses, who founded the St. Joseph Community Partnership Fund 34 years ago. Thank you.
At the heart of Catholic healthcare is the healing ministry of Jesus, taking care of the neighbor without distinction, taking care of the poor. St. Joseph Health has been doing care for the poor and community benefits since its inception and before its inception. But we didn't do it because of government regulations. We're doing it because it's the heart, it's the purpose for which we're in healthcare. St. Joseph Foundation, as it was originally called when it was founded in 1986, was founded at the request of the sisters who had said to our first CEO, how are we going to continue taking care of the poor? We're in this ministry. It is a ministry as well as a business. And the purpose of the ministry is to continue the healing ministry of Jesus. And if you go to the scriptures, you see that Jesus took care of everyone. He took care of them body, mind, and spirit. And that has caused us to do the best we can and to evolve as we saw the needs evolving. When we formed our health system, our fear was that our new leaders, who we irreverently then called the suits, because they were mostly men, might not understand how important all that was for us. So we said to our first CEO, how will you assure us that we can continue to take care of the economically poor? The Community Partnership Fund has been a way of expressing, of continuing our legacy of caring. I see the Partnership Fund as being the vehicle that's going to take our legacy of caring for the dear neighbor into the future. I've especially been proud of the systemic change that we've been able to bring about by developing communities, by empowering community leaders. That has brought whole neighborhoods and whole areas to a different level of well-being so that we can keep people well and keep them out of the hospitals. Everything in healthcare is changing. And if we are to continue what we call Catholic healthcare, there has got to go through all that change, the constant of the mission. I hope we all at St. Joseph Health and now Providence St. Joseph carry on this legacy of caring, which is also the legacy of the Sisters of Providence, by continuing to find structures, policies, and programs that will give stability to this aspect of our mission that can move into the future. The hope I hold and the vision I hold is that in the midst of the constant changing and evolution of healthcare, we will remain faithful to caring for the dear neighbor who is close or who is stranger, body, mind, and spirit, continuing to extend the healing ministry of Jesus.
Okay, so the video gave you a little sense of the beginnings of the fund and what was that vision. It was founded in 1986 by the Sisters of St. Joseph of Orange, really focused on serving our dear neighbor, working outside the hospital walls. And now in joining with Providence, now as Providence St. Joseph Health, we have the opportunity to honor the legacies of the Sisters of St. Joseph of Orange and the Sisters of Providence. Next, please. And this is our mission statement of who we are. And, it's really the second part of the statement that really resonates with the work that we do every day, which is to improve the health and well-being of the economically poor, utilizing the strengths and the diversity of the neighbors, our neighbors, to build vibrant communities. So in partnership with all of you, in partnership with communities, is the way that we are able to have an impact, a positive impact in the communities that we serve. Next, please. And this is the team for now, myself and Jason Laksamana, who you will meet in a bit. He's the Senior Program Officer. And Alisa Barrios, she's our grants manager. And then we also have on the team Teresa Beard and Carrie Shanwell. Thank you. Next. And I thought it'd be helpful for you to see that within the organization, where does the fund sit? And so the fund is part of the Community Partnerships Division. Tavia's team is also part of this division, Community Health Investment, as you can see here. And we also have Government Affairs, Education, the Office of Philanthropy. We have the Global and Domestic Engagement Group. So these are all of the teams within the Community Partnerships Division that are focused on addressing the needs in the community and working in partnership together to really have significant impacts in the communities that we serve. Next, please. And just to give you a sense of our footprint, prior to coming together with Providence, we had a presence in California, Texas, and New Mexico. Now, as part of this expansion, we now have an expansion in addition to those 3 states in Alaska, Washington, Oregon, and Montana. And so this is our new footprint. And this is very exciting for us because, Tavia is also part of a larger team. And it's a way for us to learn from each other, to also collaborate on how we can identify ways to work in the community. And the next slide really just highlights your region, Texas and New Mexico service area. I just wanted to highlight the work that we have focused in the Lubbock area and the New Mexico service area. And the next, please. And now Jason will be sharing with you a bit more about the Fund in Action and what is it that we do to give you a bit of an introduction to the work. Jason?
Hi, good afternoon, everyone. Thanks again for making some time with us. I think some folks may be eating lunch. Please keep eating. I had a late breakfast, full morning out here. But, you know, I think, as Gabby said, we had hoped to be there with you in person, to be face-to-face, to have these discussions. But we're doing the best we can with technology. And, you know, hopefully it's allowed some increased opportunity to engage. And we have some kind of fun things a little bit later on, some interactive activities that we hope will allow us to further build on this introduction with you. So building off what Gabby said, who are we? What do we do? And we are a grant-making foundation.
Jason, we can't hear you.
Jason, I'm sorry, we're having some trouble with your audio.
Oh,
Okay.
see. Looks like I have some audio issues here.
Yep.
I think you're
Okay.
good now.
Hear you
Thank
now.
you.
All right. See, the wonders of modern technology. And I'd like to say, you know, we're kind of a casual bunch here. So, you know, I get reminded of that every time I see the profile or the bio photo that I have. I'm obviously not wearing a suit right now. I think that was the only time I wore that suit for that photo. So all that to say that we really focus on relationships. We focus on partnerships. And it starts with interpersonal, professional relationships that build into actual partnerships and investments in our communities. That goes, that's a big part of this strategic grant making. It's understanding what is going on in your world, in your communities, because there are communities as well, and seeing what kind of projects we can work on together. Bringing the resources that we have, whether it be through grant making or through thought partnership or through research, it is really what we do. It's about improving the quality of life for the most in need in our communities. And really looking at and living up to our name. Community, working in partnership, but authentic partnerships, and the fund. And again, not just grants and not just money, but bringing resources, bringing us together and working together. So a little bit more about you in our next slide. And I also want to introduce our, I think we're missing a slide. Okay, sorry, again, technology. So this is our strategic framework for impact. And really, I think these are some terms and some words that you may have seen from us before or seen from the health system. But these are our pillars. And it's our pillars that drive our strategy, that inform our strategy and inform our work, both in investments and in activities. We try to focus on the upstream, on social determinants of health. Services are important, and working with our hospital partners, providing those services, but looking at what are the root causes? How can we go beyond and where we can go? Our focus on equity, and obviously equity is a big issue in our community. It's a buzzword right now in the media, but this is something that we've always focused on, not just health equity, but equity across all communities. Being collaborative, being a partner, and not doing it alone, and also not thinking we know any better. Really learning from you, learning from our partners, learning from the community. And then when we engage in a strategy, not thinking that everyone is at the same starting point. So meeting the community where they are. And that's in terms of understanding, in terms of capacity, in terms of resources, and setting different milestones for success, ultimately building capacity of those communities. And finally, not shying away from innovation. Being innovative is a necessity in our community. It's a necessity to come up with new strategies to work. So these are our pillars. All of our strategies focus on addressing, improving, or redesigning at a systems level with an aim towards equity and justice. If we can go to the next slide, or let's see. You know what? We had a little snafu on our slides, but I do want to turn it over to our colleague, Paul Bonfanti. And part of our effort here was to understand where you are coming from and who you are. And we have a little bit of an interactive poll. So I'll turn it over to Paul, who is a partner with us working with the fund.
Good afternoon, everyone. So we are now going to launch a 4-question poll. It should be coming up on your screen right now. If not, you may want to go down to the bottom of your screen and click on the poll button, and you'll see it. If you are calling in by the phone, you may have a little bit of difficulty accessing this. If you're not able to access it, don't worry. We will be having other opportunities later in the meeting to hear from you more. So as you can see, there are 4 questions. You can start answering them as I'm speaking if you wish. But the first one is, how familiar are you with the fund? The next 2 are about the primary focus of your organization and what population you serve. There is a limit of 10 choices in Zoom polls. So you see we do have an other here at the bottom. So if you're so inclined to pick other, please type what you work on in the chat very briefly. You don't have to say a whole bit, just briefly who you serve and what you work on. And then the final question is what counties you work in. Now again, there's a limit on Zoom here. We have 8 counties listed here. Those are the 8 primary service area counties of Covenant Health. But so just pick those, and again, knowing that you probably do work in other counties. So we will have we'll take a few minutes for everyone to get to answer those, and we will then share the polling results, and Jason will talk about it a little bit.
Thank you, Paul, and I do want to thank you again for participating today. This really helps us in understanding what's going on in the community. Again, we don't want to create the wheel where we don't have to. We want to partner with groups that are aligned with our focus areas, with our strategies, and hopefully can impact our strategies as well. This information is not just an academic exercise. Even this poll will help us understand what regions you're from, what regions we should be active in, what issues we should be considering. A lot of our strategies, while we have certain focus areas, our strategies continue to evolve and meet the needs of the community. So we'll talk more about that. I also add there's an opportunity for questions. We'll have a brief question and answer period during this virtual open house, but later on we'll have a much more interactive opportunity where we'll be able to break out and have some discussions in small groups, and there'll be Community Partnership Fund staff in each one of those meetings to allow us to get to know you even better.
To respond the first time, please do.
And we are capturing everything that you're putting in the chat, so thank you for entering those areas and those issues and comments there. We are documenting all of this and taking it as vital information. So,
All right, here we go. We're getting some good responses now. I think we'll leave it open for maybe about 30 seconds more. All right, so we'll give it 10 more seconds. And again, if you're not able to use the poll for some reason, or if you run out of time, we will again have opportunity to hear more about what you're doing in just a few minutes. So, all right, I'm going to end the polling and share the results.
Great. Thank you for sharing. And looks like we have some folks who are familiar with us on the call. Thank you, and good to see you again. Hopefully there is some new information here, and there will be folks here that are not familiar. So glad to meet you, and hope to get to know you even better. Thank you for going through some of the focus areas. This is similar to what we're seeing in other regions that we've had this presentation and making introductions. You run the gamut of issues. There's a lot of key issues that are of need in our communities, and thank you for your work there, and hope to partner with you. Housing, in the comments, there was a lot around child well-being, mental health, equity as an issue, and then our populations. Again, running the full spectrum here. Age, ethnicity, issue area, economic status. This is all great information for us. And then, wow, we have some great representation across. Of course, a lot of folks in Lubbock, we see that, but great to see the other communities represented. So thank you. Again, we will use this information to help us in our strategy and actually with follow-up as well. So we go to the next slide after this. A little more on our focus on the upstream. That, again, you have heard the term social determinants of health, I think, especially over the last few years. It's been bubbling up much more from the health system and from the community. For us, these are the conditions as listed here, but really the conditions where people are born, grow, live, work, and age. I like to add also play and pray. These circumstances are shaped by things like the distribution of money, of power, resources at different levels: global, national, regional, local. And so addressing the needs of the community, we take this approach, not just services, and certainly meeting services and addressing the supportive service needs of communities and individuals is important. But we balance it with trying to address at this root cause level social determinants of health. The next slide is our focus on equity. And again, it's something that we've heard, especially in light of the events and the media attention over the last couple months. But really, this is something where we have had a focus throughout our history as a foundation. Understanding that where you live is a better indicator of your health than your genetic code. And that calling out that these health inequities are real and that our work has to address equity. Creating this opportunity, creating equal opportunities for members of all populations to be healthy, to have access to health care, to have healthy outcomes, regardless of their race, ethnicity, gender, sexual orientation, immigration status, language skills, socioeconomic status. But it's also, again, recognizing where we are in our community, in our nation, in our society, a focus on racial equity and justice. Let's go to the next slide. I want to turn it over to Gabby to talk a little bit more about how we work and how we work together with others.
Thank you so much. I just really wanted to highlight everything that we do it in partnership with others. So we recognize that we can't do anything alone. We just really want to highlight our partnership with Covenant Health System, including Providence St. Joseph Health, and other groups that you see here on the slide. And we really recognize that this is a philosophy, a value, and know that it's not easy. And so just as we hope and expect our community partners to collaborate and bring others to the table to resolve issues or concerns, we do the same. So just really wanted to demonstrate some of our current partners in the communities that we serve. Next, please. You know, and an important value that we hold very, very true in our hearts and in how we engage is meeting the community where they are. The last thing we want to do is be in our offices creating a model with a very academic approach and expecting it to play out and be operationalized in the communities. Every community is different. Every community has a unique set of assets and needs. And it's very important, and we put a lot of time into listening to our communities, having those one-on-ones, having those sessions, either at this point via Zoom, but really in person to really understand not only what is the problem, but really what are the solutions that they've already identified, and how can we support that work? So we're always very open and really welcome and really need to have this engagement with the community at all times throughout the work that we do in our grant making. And next, please. And innovation. Jason touched on this a bit. We take a lot of pride in this work in the community, and we've had a lot of support from the board, from the funds board, to take on what we called informed risk. So there's a lot of models out there, a lot of them either that we've learned about in the field or we've learned in the community. And we have the opportunity to test some of these ideas out. And if some things don't work out, that's okay. We learn from that. But what we found is because we're willing to take on a little bit more risk than others, we've been able to not only learn, but also start sharing these lessons and helping other communities really touch on this innovation and implement it, included in some of those plans as well. So we're very proud of the fact that we have the opportunity to be innovative with the intent to learn more on how to do this work in the community, because it's not easy, and also share the learnings and lessons learned. Thank you. Next, please. And now take it back to Jason to talk a bit about what are those focus areas that are part of the work of the fund. Jason?
Great. Hopefully everyone can hear me. Having some technical difficulties on my end, but we're just gonna go. So here on this slide, you can see that these are our focus areas: capacity building, housing, education, and disaster response. And looking at these, you may be asking, well, aren't you a health foundation? This doesn't sound like health. And yeah, we are a health foundation, but this is a recognition that in our strategy, there's an intersectionality of these issues. There's an interplay between them, and that if we work upstream enough and we work on the—
Jason, I'm afraid we've lost you again.
Okay, so I'll continue. Apologies for some of these challenges. So with housing, looking at what are some of the root causes of the homeless issues that our communities are facing at this time. And so, as you know, there's always the need to build affordable housing, but also what are those root causes? How do we best address some of the policy aspects of this issue? And most importantly, how do we partner with the community to be that voice? Around disaster response, it's not just responding to the immediate disaster relief effort, but how do we help rebuild those communities that were impacted by disasters. And we did a lot of work most recently in Northern California. As you all remember, a couple of years ago, we experienced the horrible fires that really impacted not only the local communities, but our hospitals themselves. And so we've been working very closely with community members, nonprofit organizations, and other funders to how do we best rebuild a community that is inclusive of everyone who lives in that community. And I don't know if Jason touched on capacity building, but capacity building is not only for addressing the needs of our nonprofit partners and also the community. And how do we best provide support, technical assistance, tools, so that our communities, both nonprofit and residents, are able to be well positioned to continue their good work in times of chaos. And as you can imagine with COVID-19, we have a lot of work to do in this space, and we have invested some significant dollars in how do we best support collaboratives at this time to really think about how to best position their work moving forward as partners. Okay, next please. And I'm just gonna check and see if Jason, are you able to talk? How's your, no? Okay. And we just want to share with you a little bit about what has been some of the current investments that we've engaged in as part of St. Joseph Community Partnership Fund. One of them is around emergency food and shelter. And this initiative is really focused on responding to the basic needs of our communities. Our Intersections initiative is looking at providing the table so that different sectors are coming to the table. We convene them, we work in partnership with others, and addressing some of these complex issues. So a lot of work has already been done around housing throughout the state of California. And you can see the value of bringing our nonprofit partners, but also our business partners, our policymakers, other funders, to really think about how to address these complex issues. And we've engaged our communities, our collaboratives through a process and a lot of technical assistance and support. Our community building initiative, very similar and really focused on the community residents and gaining those skills and tools to be the voice of change, but also be the ones at those planning commission meetings, at those city council meetings to advocate for change. I already touched a bit about our disaster relief, and our sustainability initiative has really been focused on helping our nonprofit organizations really have the opportunity to think about how to best sustain their mission, their work. And this is part of our capacity efforts. And the last is our innovation grants. We've got a number of investments that we've made in this space that has really helped us learn about how best to address some complex issues, either within our community clinics, networks, or some of our nonprofits. Next, please. So just a little bit about some of the work that we did around responding to COVID as part of Providence St. Joseph Health. For phase one, we had an immediate response. We worked very closely with Tavia and her team in identifying organizations, one or two per region, that really were focused on preventing, minimizing the spread of COVID in the vulnerable communities that we served. And that took place in March and April, a couple of months ago. And now in phase two, we recently released a letter of invitation. We can go to the next slide, please. And we're calling this the Community Recovery and Resilience Initiative. In addition to our immediate response, is really working to support those collaboratives that are now thinking about how do we continue our mission in midst of this chaos, in midst of this virus, in midst of this economic impact in our communities. So we just received letters of invitation. We received some from your region as well. And we're in the due diligence process. And we're looking to funding beginning towards the end of this calendar year, probably in November. And we are looking to invest about $1 million in this effort. Okay, next please. And really wanted to share with you the work that we've engaged in as part of the fund in contributing towards the research and field building of community building and community work. We take a lot of pride in this because we really want to share the learnings in the field that we've gained either through our grant making or investments, and again, working in partnership with other funders to inform each other and how best to do this work. And so we've engaged in a number of areas around equity, around rebuilding communities as part of the fires that we had in Northern California. And as you can see, bringing people to the table and many times as part of our work. So this is our contribution to the field as a way to really help educate others and for us to learn from others as well. And the next slide, please. Okay, so have Paul now lead us in this discussion around some questions.
Hello, everybody again. So I think we are going to ask you to have any questions. You may have some questions by now. So if you have questions and want to enter them into the chat, with so many people, it would be difficult for us to take them verbally, but we will again be having some breakout group opportunities at the end. So let's see if we have any questions in the chat right now. And I'm not sure if Jason is back online. I'll probably be sending most of these to you, Gabby. Right now, we don't have any questions in the chat.
Okay.
Anybody will take a second for people to have questions?
So I see a question, what do the funding cycles look like? That's a good question. So right now, because of the new focus areas and we're looking to expand into the entire footprint of Providence St. Joseph Health, we are in the process of doing those funding cycles, those timelines, those schedules. And that's something that we will be sharing on our website. So at the end, you'll see the address to our website, and that will be one way that we can communicate. And of course, we'll be sharing this information with Tavia colleagues as that progresses.
Gabby, we have a question. Is there a specific project you've funded that you were exceptionally proud of?
There's many. I mean, one is, and because the community taught me, I think I gained a lot more than the community did. It was in Northern California, and it was part of our community building initiative. And the focus of that initiative is having the community tell us what is that health issue. And, you know, we come from a health system, and the community said, we really want to focus on a sense of community. And I remember looking at them like, okay, what does that mean? And I was very open to the journey where learning about the community where we have Native American, Latinos, and a Caucasian community that just didn't get along, and their focus were their kids in school, and they wanted a sense of community. And really looking to the community to teach us what that would look like and what that meant to them. Building a park. They didn't even have any green space in that area. Working with a private owner to donate land to build a park. Working in the school setting to really address some policies around bullying. And my team learned a lot of that, about how to meet the community where they're at. And so much good work has come out of that. The best is there is a sense of community now. It was all focused on the kids. So I think that's one example of one of the engagements that I always think about and I learned a lot from.
Another question, Gabby, are there specific things you do not fund, such as staff salaries, construction projects, overhead, etc.?
So we do fund those areas depending on the initiative. So perhaps, we're not sure yet, we've never really funded capital, but it could happen that within our housing, there may be an opportunity for us to engage in that and work. We support operating expenses, we support staff. Again, it depends on the initiative and the focus of that work. And so we try to be as clear in our RFPs and our communications and always open to conversations about that.
Any other questions folks want to add in the chat?
Okay. And I think, Paul, we'll have a chance to have some discussion during the breakout session. If other questions do come up, we'll either answer them towards today or also provide them as part on the website? Okay, Paul.
All right, so then one quick question is, will this deck be shared? Yes, it will. It will be shared probably sometime next week. All right, so let's. Gabby has mentioned the breakout groups, so let's start talking about the breakout groups. So in a couple minutes, you are going to get automatically moved to one of 3 breakout groups. Now, for those of you who have not done Zoom breakout groups, they're pretty cool. You don't have to do another link or anything like that. I'm going to hit a button on my side, and you'll get moved into that group automatically. In that group, you will be in about 10 or so people with a facilitator as well as a staff member from the fund. And you will be asked to discuss 3 questions. So the first one is not on here, and that's one that we're going to ask you to put in the chat, and that's just introducing yourself. So your name, the organization you work for, and maybe very briefly what that organization focuses on. The second question is on the screen here, and is one that we do want you to discuss verbally if you're so moved. And that is, what collaboratives are you involved in or know about in your area? And I want to be clear, by collaboratives, we're not saying how do you collaborate with other organizations. We know that you're all doing that every day, but rather kind of formal collaboratives that meet maybe with an MOU, maybe without an MOU, but formal collaboratives of multiple organizations that meet, get together for some shared purpose. So we're going to ask you to identify them again, ones you're involved in, but also ones you aren't involved in. And we're doing this both so the fund can learn about it, but also so you within your own breakout group may learn about it. You may hear about a group that you didn't know about, a collaborative you didn't know about. So there's an opportunity for you to learn more about that. But the big part of the meeting of the breakout group is going to be this third one, which is, it says here, dream big. For those of you who are familiar with the concept of a BHAG, a big, hairy, audacious goal, that's really what we're looking for. If you had a magic wand, what major change would you make in your communities to have the most impact? Again, this is a magic wand exercise, a BHAG exercise. It doesn't necessarily have to be realistic. And we want to approach this like brainstorming exercise. So, if someone says an idea, we don't need to get into the reasons why that's not going to be doable or what the obstacles are. We really want dreaming big and thinking about what could happen, again, with a magic wand. So those are the 3 topics. Again, we will have 20 minutes to do this, so we will bring everybody back at about 2:10. You will get a text message saying that you have 1 or 2 minutes left, and then wrap up, and then you'll get another warning which says 30 seconds. And then you will automatically get pulled back into the main room, and we'll have report outs. Before we do the breakout, I am going to ask you to, if you don't mind, turn on your video camera so that to aid the discussion. And with that said, enjoy your breakout groups. Welcome back, everyone. We are going to be taking a few seconds for everyone to come back from the breakout rooms, and then we will do report outs. All right, so we should have everybody back. So thank you for the participation in the breakout groups. We're going to have brief report outs from each of our facilitators. So we will go in order of the group. So that is Haley, Marilyn, Carrie.
Okay, thanks, Paul. Thank you, breakout group number 1. I am sorry to one of you that you weren't able to share verbally, but we did capture your ideas. So in our group, there was a lot of discussion about homelessness, housing, especially for eliminating the issues of teen homelessness. There's a lot of middle school and high school couch surfers, people that do not have a stable home, and it's hard to find resources for that group given their kind of in between age where they're not able to sign for things themselves, and they don't have a guardian that they're necessarily in touch with to do that for them. So teen homelessness. and also food security and things that are kind of related to food security. There were some really interesting ideas about creating more emphasis on local agriculture and supporting local agriculture and sustainability. There's a lot of collaborative groups represented in our breakout group related to the South Plains Hunger Solutions Group and Food Bank. So they're very aware of the need for solutions in the area of food. Mental health is also a huge need and a huge goal to serve children in all grade levels, especially now during the pandemic. There was a lot, obviously everyone knows that the pandemic has had an impact on mental health. So creating some priority in that area. And then we ended the conversation talking about a really interesting topic, which was the inequities within Lubbock. So creating more equity within Lubbock. There were several really, really key anecdotes shared by members of that breakout group about, you know, the different zip codes and how even within schools, the conversations that were going on in schools at a certain time were all about the changing demographics. And the organizations and the people in this group were saying, yeah, we don't worry about changing demographics and we don't discriminate. We need to have an equitable Lubbock where it doesn't matter what side of the tracks, so to speak, you live in, but your health is high quality no matter where you live. So that conversation was great, and I'm gonna actually just read the specific big, hairy, audacious goal about zip codes is that they don't determine our health and well-being, whether we live in 79401 or 79424. So very specific to the zip code. So thanks for that comment. And that's it. Thank you.
Okay, so in breakout group number 2, we had some similar conversations. So some of the big umbrella areas or BHAGs were housing, specifically using prioritization. So housing those with the greatest needs first, and the discussion about when, you know, if you provide housing, it could potentially help with other needs at the same time. And just ensuring that by using prioritization, ensuring that those with the greatest needs don't fall through the cracks. Then we talked about needs of children and families and how sometimes we don't even know or are aware of what they need or what resources are available. So the conversation about that was creating sort of a coordinated system or effort to help and understand what resources are available so that we can kind of feed off of each other. Also talked about the ADA Disabilities Initiative, so providing education to youth who are living with diabetes and just having more resources available and local staff to be able to reach out to those children and youth. Also talked about mental health and reducing stigma in particular. And then we talked kind of in relation to that was transportation. They can't, you know, people sometimes can't get to appointments for whatever reason, and just how rural and spread out the area is. It sometimes is hard to get to appointments in general, but specifically, you know, around mental health, it's kind of been in some ways helpful that things are becoming more virtual, and some people with mental health issues are actually keeping their appointments more than they were before. Kind of that, you know, there's a little bit of a distance there, but they're still able to get the help they need. So that was kind of the bulk of our conversation, and thank you everyone in my group. I know one person got cut off at the end there, so if you would like to share your idea, please type it in the chat. Thank you.
Hi everyone. So group 3 had a robust conversation, and I'll apologize to this greater group that there seems to be a lot of work happening on the roof of our building, so you may hear some pounding. So our group talked about some collaboratives, but mostly they actually just talked about how blessed they are in Lubbock to have a really communally oriented city. and that people are just in general collaborative, individuals and organizations, and it's kind of a wonderful and consistent thing. And that agencies like CASA and CPS really are powerful presences. Someone also talked about the South Plains Homes Consortium and other networks and the work that Catholic Charities does. So as far as big, hairy, audacious goals, some of the same themes that I've already heard, but one was really finding a way, sort of like a more expansive charity tracker that would allow all of these organizations to really stay in tune with one another and know what others are doing. Also another big, hairy, audacious goal was combating generational poverty and really looking at ways to do that through today's kids, to teach them more resilience and skills to stave that off in the future. And teaching kids who are able, teaching kids to be able to really have goals and plans for after graduation and help parents who are really struggling to help their kids with that. Then as far as the foster care system, the biggest, hairiest, audacious goal was just no more abuse or neglect. And having enough foster families to really accommodate kids as they are exiting their own family environments, to not have to be in institutional surroundings, but also really helping teach parents how to parent to prevent abuse and neglect. And then last but certainly not least, as far as homelessness, really getting a handle on the mental health issues facing that community and other vulnerable populations, really getting clients to want to come in, and again, looking at intergenerational poverty and really galvanizing the ability to be able to meet clients where they are and to really maximize that capacity. It was a great conversation, and I thank all of the amazing women in my group. That was us.
Thank you everybody for participating and having so many great ideas, and thank you to our facilitators for facilitating and reporting out. I am going to pass it back to Jason and Gabby for the closing.
I'm going to check if Jason is back. Okay. So again, want to thank all of you for this opportunity and for this time, for us being together and learning a bit more about Lubbock. Thank you, Tavia, for your support on this effort. And, you know, again, we will be providing you with the slide deck. The main session was recorded, not the breakout, so that will also be included. We will be sending those to you directly, and then it'll also be uploaded on our website. So you can see here, please feel free to contact us, our email address. And to learn more about the fund, you'll find our website at stjosephcpf.org. I just want to thank everyone again and hope everyone has a good rest of the day and rest of the week. And please be safe. Have a good day. Thank you.
Thank you so much. It was wonderful.
Thank you. Bye-bye.
Thank you.